right, so we're inside the cranial cavity now, and I'm going to start with the anterior side. And here is the crista galli of the ethmoid bone sticking up. That's what we call the shark's fin. Sitting on the cribriform plate, the holy plate of the ethmoid bone where the olfactory nerves pass through. And then surrounding that, you've got your frontal bone. So this is all frontal bone here. And then if we move posteriorly, we've got the lesser wings of the sphenoid bone here. And just under the lesser wings, you have two openings that come from the back side of the orbits. They're nice and round. Those are the optic foramina, or optic foramen. So the optic nerves from the back of your eyeball go through there. Here is the sella turcica, the Turkish saddle, where the pituitary gland sits. This portion of the sphenoid bone is where you can see a significant portion of the greater wings of the sphenoid here. And then we're going to look at 4 different holes or openings. I have to kind of tilt the skull so that you can see the first one, which is right here. And this is the Foramen Rotundum. And when you stick your probe in the Foramen Rotundum, it's more in the transverse plane. That's the orientation of this opening. And then if you go back, you've got your Foramen ovale, and this one is pretty narrow as far as Foramen ovale goes. And then the piece of the Foramen ovale right here was broken off, and this is the Foramen Spinosum. The Foramen Spinosum is a tiny little opening compared to the other 2. So I like to call these the Ross trio, R-O-S. So you have Foramen Rotundum, Foramen ovale, Foramen Spinosum here. Then medial to the ovale, you have kind of a larger opening here where the sphenoid articulates with the temporal bone and the occipital bone, and this is the Foramen lacerum. Foramen lacerum. Okay, we'll continue to move posteriorly now, and we're back in this large depression of the posterior cranial cavity. And if we look right here at this sort of dimple-like opening, that's the internal acoustic meatus. And just below the internal acoustic meatus, you can see the jugular foramen, which we often identify on an inferior view of the skull. And if I keep my probe in there and I turn this around, you can see where that jugular foramen is, which is just lateral to the occipital condyles. Okay? So, so this part right here is part of the temporal bone, remember? So that internal acoustic meatus and the jugular foramen, which is only present in an articulated skull, are associated with that temporal bone. Okay? And then the final structure that we can identify here is the foramen magnum, part of the occipital bone. Okay.